We have a segment now about lupus. Here's our reporter, Laura Windsor.
According to research estimates, at least 1.5 million Americans have lupus, with women being the largest percentage living with this disease. We spoke with Dr. Michael Lovy, a Desert Regional Medical Center in Palm Springs, California, who explains the symptoms and treatments for this disease.
Lupus is a disease of the body gone wrong. And some of the mechanisms that we all have in our body and need to fight infections and tumors are misdirected against the body's own tissues. And this can include just about any organ in the body. So how lupus looks depends on which organ is involved, and certainly it can present in a very wide spectrum of complaints and physical findings. And for that reason, it can be confusing to recognize. There's certain things that occur very commonly, and those are rash and joint aching. So it is in form of arthritis, but that's just scratching the surface with the kind of problems that can occur. A quick rundown would be a sun-sensitive skin rash, arthritis, pleurisy, which is inflammation around the lining of the lung, inflammation around the lining of the heart, pericarditis, kidney involvement, which may not have any symptoms at all, and then a lot of blood disorders. Any of those problems in combination with a positive blood test called an ANA will get you on the road to diagnosis. You might not find those four all at once, and that's part of the problem with the delay in recognition. It might just start with one problem that seems to be unusual and doesn't go away.
We asked Dr. Lovy, what is the treatment for lupus?
Treatment depends on how severe the involvement is. This is a disease of young women. The peak onset's in early 15 to 25, and those are women where the first recognition may occur during or shortly after pregnancy. And of course, some of the complications of lupus can be catastrophic in that setting. If you have kidney involvement, the long-term risk of losing a kidney or increasing mortality is quite considerable. So obviously, you're going to treat that patient with medications that are more aggressive. When it affects the brain, causing seizures, there's no time to wait. When you're presenting to the hospital with severe anemia or bleeding due to low platelets, there's no time to wait. And in those circumstances, you're going to be using strong immunosuppressant drugs, similar to what we would use in patients with transplants. Not all lupus is that bad. I think once there's recognition, the important thing is to be monitored regularly, even during times when you have no symptoms.
Dr. Lovy explains what lupus patients should avoid.
Once you've got it, you can't lose it, you can't shake it. But how do you avoid it? I guess the recommendations I give my patients are to avoid stress, avoid sulfa antibiotics. That can often be a trigger for the first presentation of lupus. Sunlight certainly triggers it. And then there's a genetic component. And some of these things you really can't change.
We asked Dr. Lovy what kind of medications are prescribed.
But there is some exciting news with drugs, transplant drugs that seem to allow us to use lower doses of prednisone. Hopefully one of these drugs will pan out to save patients the problems associated with disease flare-ups and high doses of steroids.
Lupus can be extremely difficult to diagnose in early stages due to confusing symptoms. But with recent medical advances and treatments, living with lupus can be manageable. For the American Health Journal, I'm Laura Windsor.